Are you dealing with back pain or maybe back pain that's radiating down your leg? Well, a lot of people will call this sciatica, and it's in a lot of cases the correct diagnosis. But today, I actually want to talk about what is true sciatica and what are some of the myths of sciatica or what are some of the misinterpretations of sciatica that patients have. Hi, I'm Dr. Gouveia with Health Fit Chiropractic. Are you ever dealing with pain when you're sitting for long periods of time or when you bend forward that seems to shoot down the leg? Well, this sounds a lot like a sciatic presentation. And today in this video, we're going to talk about what are some of the most common symptoms of sciatica, how do we evaluate it here in the office, and what sort of treatment options do you have? Because there are far more treatment options than just going under the knife and getting surgery or getting injections or going down some of the more invasive treatments. I always recommend conservative care first because many of these patients will actually get full resolution of their symptoms using chiropractic care and some of the different techniques that we use here in office. And we will discuss a lot of these different options that we have here today. We're talking about sciatica today. And like I mentioned before at the start of this video, it's one of the most common patient diagnoses. What I mean by that is so many people come into my office and say, I have sciatica. We're gonna talk about true sciatica and what that pain pattern would look like. So I'm gonna have them turn around. Sciatic patients will often have some level of back pain, but more often than not, the pain is actually going to be worse going down the back of their leg. It's going to be maybe hamstring pain or a little bit of glute pain and hip pain. So when they come in with that, the first thing that we're going to do is we're going to take a look at a range of motion. We're going to have them bend forward and try and touch their toes with their knees locked. Oftentimes, this will be a very painful position for them, and it may actually elicit the symptoms going down their leg. Then I'm going to have him turn around. I'm going to have him put his feet together, hands overhead for me, and then just lean straight back. This we'll also typically see, it can be painful in many of these sciatic patients, but even more commonly, we'll see just a restriction where they can't seem to go as far backwards into extension through this lumbar spine as we would like them to. So we'll come back around here. These sciatic patients tend to see that their symptoms are a lot worse when they're seated, when they're driving in their car, or when they're doing anything in a forward flexed position. One of the things that we want to pay attention to is exactly where their pain is. What does it feel like? Is it tingling? Is it sharp? Are they losing any strength? So in all of our patients, we're not going to show it here today. If you have radiating symptoms like this, we're going through a full neurological examination. Do you have motor weakness? Do you have reflex changes? Do you have sensory changes? We're going to go through all that in a typical patient, but not here for the video. So we saw that he was restricted into extension, and we saw that flexion actually flared up his symptoms. So the next step that we're going to do is he's going to come over here. He's going to have a seat on the bench here. What we're going to do is we're going to actually tension that sciatic nerve. So I'm going to have him extend this leg all the way out. We're going to point the toe up, and then he's going to hunch forward, make really bad posture, and we're going to pull his head down. In a true sciatic patient, this is going to light him up. The pain is going to typically shoot right down all the way into the foot in many of our cases. And to jump right forward to some treatment, if we see that this is a sciatic patient, this is actually almost exactly what the treatment will look like. We're going to do something called nerve glides. And so Stefan's going to do it here. We call it kicking your head off because it's a way to sort of visualize exactly what we're trying to do. But what we're doing before we get into it is we're actually moving the nerve back and forth. The nerve is attached all the way to the base of the foot. And it's attached in the spine. So he has to move his neck and he has to move his leg to glide that nerve up and down and potentially release any adhesions. So Stefan, go ahead and kick your head off with a sciatic nerve glide. So you're going to go forward, and then you're going to extend this leg. Head is going to go all the way back, and toe is going to point. And he's going to repeat that. And going forward again and backwards. So this is something, if you're at home right now and you're saying, I'm feeling this exact pain, try this. It may irritate it at first, but if we do 10, 20 reps, you may actually feel it relieve as you go through this process. The next thing I want to talk about as a take-home exercise is they're called Mackenzie extensions. In the exam, we saw that Stefan had trouble going into extension like this, and so we want to reintroduce that. We want to try and actually see if that can become a relieving position. In order to do this, I'm going to have him lay on his stomach. We're going to apply a little bit of pressure to his low back here, and I'm going to have Stefan push up as high as he can go. Just like that. He's going to keep his hips on the table, so drop down just a little bit for me, right there, and then go back down. We're going to repeat this 10 times. This tool here, go ahead. This tool here is actually an evaluation and a treatment protocol. So if while he's doing this, he starts to notice that the pain in his leg or his sciatic symptoms are actually decreasing, Or maybe they were going down to the foot and now they're only going to the knee, and then now they're only going to the hip. And they're kind of, we call it centralizing or returning to the center of his body or to his back. These are all positive signs that this is going to be a really useful treatment tool for him. And so I'll prescribe a lot of my patients take home McKenzie extensions. This is something that you can try at home. However, a little disclaimer, if you're trying this at home and you're noticing that the pain is getting worse in your leg, or maybe it was going to your knee and you started to do this exercise and now it's going to your foot, that's a red light. That's a full stop. I don't recommend patients self-treat without a full proper examination. However, this is something that you can use at home to try and relieve some of your symptoms. Finally, I want to show you something that we have that's a really cool tool. He'll stay on his stomach here. No, stay on your stomach for me. Something that we would do in the office if you're dealing with this back pain and sciatic-like symptoms. So Stefan, you can let your arms relax. This is called flexion distraction, and we have a really awesome table here in the office. What I'm going to do is we might see that there's actually some disc involvement here. We can feel those restrictions. And so what we will use this table for is it actually moves. And I can hold down that lumbar spine, and then we can distract it as we go into some flexion here. And we're going to do every segment of the lumbar spine to help relieve some of the tension, because sciatica can be caused by a lot of different things. One of the most common causes is actually a disc herniation or a disc involvement. This is actually decompressing those discs. This is causing that traction on the spine and can actually relieve some of the tension off of the nerve causing the symptoms. And so this is a really, really useful tool that we use for these sciatic patients and low back patients. We can also use this table to help release some of the back muscles that go into spasm typically with a sciatic presentation, just like this. This feels great on a lot of patients. It's extremely useful, and it's really effective for actually making physiological changes in that tissue there. So we'll lower them down. And that's what our in-office treatment and evaluation would look like. You can have a seat up. Would look like here for sciatica. We're going to talk about some more exercises and some more things that we can do when you come to the office and to do at home. But this is just a start, and this is what it would look like if you came in with these symptoms and how we would treat it. Okay, so we've talked about some of the treatment that you'll get if you're suffering from sciatica here in the office. We talked about nerve glides. We kick our head off like that. We've talked about extension exercises when you're laying on the ground. But those are palliative exercises. Those are exercises that are designed to decrease that initial pain. But we want to actually progress through our treatment plan and talk about what does it look like once we're out of pain or once we can manage our pain. Well, then we got to work on mechanics and or work on improving how we move so we stop aggravating it and we stop the aggravating factors. So one of the main causes, of sciatica is a flexed posture. We're reaching for something, our low back is rounded and flexed. So what we want to work on here in the office, and you can do this at home as well, is something called a hip hinge. A hip hinge is when you push your hips backwards, your low back remains neutral, and this allows you to get things off the ground, pick things up off the table safely without rounding your back and potentially irritating whatever is causing your sciatic symptoms. So the way that we teach this is you take a dowel, you can use a broom. I'm Canadian, we used hockey sticks back at home. You have the dowel touching 3 points of contact, your head, your mid-back up here, and then right at the base, your belt line basically. When you're doing a hip hinge, you need to push your hips backwards and you need to maintain contact with the dowel at all times. And if you practice this, you'll feel a lot of tension in your hamstrings if your hamstrings are tight like mine are, or you might have trouble. You might notice that the dowel rolls up if you round, or a lot of people will forget about their head and they'll arch forward. We don't want that. We want to train this hip hinge in order to make us move better and avoid any flare-ups of our symptoms, because we worked really hard in the room to get those symptoms under control. You've worked hard to do those extensions and nerve glides. This is how we move forward, get you out of pain, and make sure it doesn't come back. You've got the hip hinge down, we're moving a little bit better. The final stage here is to get true core activation. Core activation stabilizes the entire lumbar spine, and that's one of the best things that you can do if you're dealing with sciatica, is actually get all your muscles creating almost like a weight belt, like if you'd wear it while you're squatting. Get them all activated together, support that lumbar spine. So the way that I like to teach this is I'll have our patients lay on their back. Many patients may have heard of something called a dead bug. It's like this. This is a great exercise. However, it can be a little too advanced for people who are coming out of a really bad flare-up of back pain and sciatic pain. So we start a little bit simpler. We start with filling our abdomen with air. So we're going to breathe in, just like this. You want to kind of make it look like you got a bit of a belly there. And then you're going to put your legs up. This is step one. Our back has to remain flat on the ground, so we're tilting backwards, and we're just going to hold it like this. If the patient can tolerate it, or if you guys can do this at home, you can make it a little more challenging by actually having a weight up like this and slowly letting it down backwards and back up. All the while, we're keeping pressure in our abdomen, which is going to contract our core, and it's going to help actually support the lumbar spine in this exercise. We have a lot of ways that we can advance this. This is really step one. This is somebody who's coming out of a really acute flare-up of their back pain. This is where we would start. And you can do this at home. I just want you to think about flattening the low back, breathing through your stomach, and just holding the position. You don't have to have any movements when you're first trying to work through this. So it's a good tool to use to help core stabilizing. It sure beats doing crunches for core, which a lot of people think that they want to do. This is the best way to get started if you have back pain, sciatic pain, or any types of things that core stabilization can help with. Start here in this position. So if you think that you might be dealing from sciatica, or you just have back pain or a different weird presentation of your back pain, give us a call at 561-997-8898. We'll get you in day of as best we can, take great care of you. What we're going to do is we're going to go through that full evaluation. We're going to determine exactly what is causing your symptoms, and we're going to create a concise treatment plan to help get you through whatever ailment you're dealing with.